First I'll take methylxanthines because it may ask for 10-mark question. You should know what is the mechanism, uses, and adverse effects of this. And like if physiotherapy students, if you write pharmacological actions also, it's well and good only. Drugs in this class is theophylline, theobromine, caffeine. Caffeine is present in coffee, tea, right? Coming to the mechanism of action, it's having three mechanisms. I'll tell first in brief. One is the release of calcium from sarcoplasmic reticulum, especially in skeletal and cardiac muscle. Like how it will help, it's not given in detail. Inhibition of phosphodiesterase, which degrades cyclic nucleotides. This is the second mechanism, and blockade of adenosine receptors. Coming to the mechanism, so this ATP get converted into cyclic AMP by adenyl cyclase enzyme. Adenyl cyclase enzyme, and this cyclic AMP get converted into AMP, adenosine monophosphate, by phosphodiesterase enzyme. When you give this methylxanthines, they block this phosphodiesterase enzyme. So when cyclic AMP level will be more, okay. Due to that, ATP get converted into cyclic AMP. Cyclic AMP, if phosphodiesterase is not available, it will not get converted into AMP, adenosine monophosphate. If cyclic AMP is not get converted, then the cyclic AMP level will be more, right? AMP, it is not adenosine monophosphate if it will not get converted. Then if cyclic AMP level is more, means what are the advantages? It causes bronchodilation and decrease release of cytokines, the inflammatory mediators, and decrease immune cell migration and activation also. All these mechanisms you will see when cyclic AMP level will be high. When this will be high, if methylxanthines, it blocks phosphodiesterase enzyme. The next mechanism is adenosine. When it binds to a adenosine receptor, what are the on the mast cell, what are the actions it will do? It causes release of inflammatory mediators like cytokine, prostaglandin, leukotriene, histamine. All those inflammatory mediators it blocks. Now what is the mechanism of methylxanthines? Means like all these overall causes bronchodilation, right? So if you inhibit the binding of adenosine to a adenosine receptor by using methylxanthines, you will not see bronchoconstriction. Instead you will see a bronchodilation. These are the three mechanisms. You don't need to go with these diagrams. You can write it in a sentence. One is it will causes blockade of adenosine receptors and release of calcium from sarcoplasmic reticulum, especially in cardiac and skeletal muscle. And also inhibition of phosphodiesterase enzyme. That is one more mechanism that in turn increases cyclic AMP level. Okay, these are the three mechanisms. Coming to the pharmacological action on the CNS, stimulate medullary, vagal, respiratory, vasomotor center also. Vomiting center is, it may induce vomiting also as a side effect due to stimulation of chemoreceptor trigger zone. Smooth muscle relax, especially bronchial smooth muscle in case of asthmatics. Biliary spasm is relieved. Also inhibits antigen induced release of histamine from lungs. Skeletal muscle, caffeine enhances contractile power of a skeletal muscle. Example like theophylline causes dyspnea, difficulty in breathing due to this. Mast cells and inflammatory cells decrease the release of histamine. CVS stimulate the heart. Action on the CVS, it stimulates heart, increase heart rate like tachycardia you may see, and there may be chance of like cardiac higher doses only you'll see cardiac arrhythmias like irregular heart rate, bradycardia, tachycardia. There is chance. Effect on BP is variable, like when vasomotor center stimulation and direct cardiac stimulation causes rise in BP, and vagal stimulation and vasodilatation causes fall in BP or low BP. Usually there is a rise in systolic and falling diastolic BP. Usually you'll see. It dilates systemic blood vessels also, caffeine especially. Caffeine it constrict cranial blood vessels used in migraine. Because of that, like when you have headache also, you will have coffee, you feel some relaxation. That's the reason, because it causes constriction of the cranial blood vessels. Kidney, it is a mild diuretic, inhibits tubular reabsorption of sodium and water. Like urine formation, it occurs in 3 steps. One is glomerular filtration, tubular reabsorption, and tubular secretion. Usually it will inhibit the tubular reabsorption, like increase urine formation. Diuretic means increases the urine formation. Stomach, it stimulates secretion of acid and pepsin. Metabolism, increase basal metabolic rate. Pharmacokinetics, will absorb orally. These are given oral route. Crass placenta and secreted in milk, 50% bound to plasma protein. Plasma half-life is 7 to 12 hours. Theophylline, it undergoes first order to zero order kinetics. That also I explained already. And it comes in a narrow therapeutic range, means you should not go beyond the therapeutic range dose. The chance of adverse effects will be more. Factors which need dose reductions are like age, more than 60 years patients, congestive heart failure, pneumonia, liver failure patients, you should reduce the dose. Uses in bronchial asthma, chronic obstructive pulmonary disease. Apnea, a cessation of breathing in premature infants. Theophylline reduces frequency and duration of episodes of apnea. Oral or intravenous route for 1 to 3 weeks you can give. See here, you can see I told it's having narrow therapeutic range, like which are the drugs we have, like one is lithium, it's used in mania. Second one is the theophylline, this is used in bronchial asthma. And one more class of drug, that is aminoglycosides. These all have narrow therapeutic range, like it should not go it should not exceed the therapeutic dose, maximum therapeutic dose you should not exceed. If you exceed, chance of adverse effects will be more. See here they have shown when you increase the dose, what are the adverse effects you will see. 5 microgram per ml minimum side effects. 15 microgram you will see dyspepsia, indigestion, headache, nervousness, insomnia. If you go 20 microgram, restlessness, tremor, vomiting, palpitation, diuresis, like urine formation increases. 25 microgram per ml, agitation, like you feel confusion kind of state, and tachypnea, flushing, redness on the face, hypertension. 30 microgram per ml, delirium, worsening cardiovascular status, increase muscular tone, extra systoles. Like you know what is systole and diastole. Systole is the relaxation state, diastole is the systole contraction, diastole relaxation. Systoles will be more when compared to the diastoles. 30 microgram per ml, death, convulsion, shock and arrhythmia may occur. Shock will occur usually. Yeah, maybe chance of cardiogenic shock may occur. I'll continue with the other class of drugs in another PPT. Thank you.